We begin in India, where life-saving oxygen supplies are running out, threatening to turn what's already a public health crisis into catastrophe. The government is already diverting supplies from industry in a desperate attempt to help those in need. But with new infection rates breaking global records for a fourth consecutive day, the worst could well be yet to come.
Overwhelmed and undersupplied, this Delhi hospital is one of thousands across India besieged by the country's second coronavirus wave. As the dead are carted off, patients too sick to move languish on the pavement. Helplessness spills into anger. Her mother on the verge of death, a woman cries, "This hospital is useless." Inside, there's almost no room to stand, and patients are forced to share beds. There's disbelief that hospitals are under-equipped to deal with the crisis. Distraught relatives appeal to the government for help.
Please do something and please release some oxygen supply. People need it here. People need beds here. People need meds here. People need wards here. People need injections. People need medicines.
Health experts blame the surge on a highly contagious variant. It hit after the government declared victory over the virus in January. Now it's urging patience. When encountered with serenity and patience, most people get well by taking care of themselves at home. There's no need to create panic and run to hospitals for little things. But oxygen and medicine are not little things for people battling to breathe. With the underfunded health system in a state of paralysis, others are stepping in to help. The Sikh temple in Delhi has secured oxygen for the infected. There are people dying at home because they lack oxygen, and others who aren't getting any help from the administration or a hospital. We are helping to save lives. Authorities are now diverting industrial oxygen for medical use and ramping up efforts to get it to hospitals quickly. But even when supplies arrive, India will need more than just oxygen to contain its devastating second wave.
Well, for more, I'm joined now by DW's Amrita Chima in Delhi. Amrita, the city of Delhi has just announced an extension of that lockdown, but PM Modi still rejects a nationwide lockdown despite record numbers of infections. Why is that?
Rebecca, last year when Prime Minister Modi declared a national lockdown, it led to a near humanitarian disaster. The lockdown was imposed at very short notice. It left hundreds of thousands of people without any jobs overnight, and especially daily wages, who were forced to leave for home, go to their villages, and you might remember images of hundreds of thousands of people walking thousands of kilometers on foot going home because there was no transport during the lockdown. So this time, the strategy is that each state, each individual state should decide what measures are most appropriate. And as Delhi is the hardest hit city in the country, the local government here has decided the only way to stop the spread of this virus is through a lockdown, to stop people-to-people transmission, because positivity rate had gone up to 37%. And there are indications it has been going down for the past few days when a lockdown was in place, which is why he thinks the only weapon the local government has at the moment is to extend the lockdown for another week.
Right. Well, authorities there in the city of Delhi have asked for the national government for support in getting oxygen. What are the national government doing to help the hospitals in the affected areas?
Well, the local government in Delhi says it needs 700 tons of oxygen. At present, it has less than half that amount. So the local government, headed by Arvind Kejriwal, has asked the national government to increase Delhi's quota. He's also written to all his counterparts in different states in India, appealing and urging them, if they have any surplus oxygen, to send it to Delhi, because Delhi is really going through an oxygen emergency right now. Hospitals are still begging and appealing for more oxygen. At the national level, the Prime Minister held a special meeting to discuss the supply of oxygen, how to augment supplies. And he's also set up, an oxygen corridor. He's set up express railway trains, and he's also mobilized the Indian Air Force. An consignment of oxygen was brought from Singapore last night. More is expected from the United Arab Emirates. So help is on the way, but the situation in Delhi remains very tense.
Well, you mentioned the UAE there. What kind of support is India getting from foreign countries, from the international community?
Rebecca, people who are seeing images coming out of Delhi obviously can't stay unmoved, and offers of help have come from all over the world, from the United States, from the UK, from France. Germany, in fact, is sending 23 mobile oxygen generating plants to Delhi. They're supposed to come into India within the next few days. And also the private sector within India has been offering to divert their industrial oxygen towards medical oxygen supplies. So there is a lot of effort being made to augment Delhi's oxygen supplies. But Rebecca, time is of the essence. For people who are suffering now, it's literally a matter of life and death.
All right, Amrita, thank you. DW's Delhi Bureau Chief, Amrita Chima. At least 27 people have been killed and dozens more injured after a blaze broke out in a COVID ward of a Baghdad hospital. Iraq's Prime Minister has called for an investigation into the cause of the blaze and declared 3 days of national mourning.
It's the stuff of nightmares. A COVID ward overrun with smoke and flames. Patients who were already struggling to breathe, now on the verge of suffocating. Rescuers say at least 20 people died as a result of the fire and are still searching the scene of this Baghdad hospital. This video, posted on social media, claims to show the moment an oxygen tank exploded and started the fire. In just a matter of minutes, the situation is out of control. In the beginning, there was an explosion. It started from there. The second explosion was over there. The fire spread quickly. The smoke reached my brother, who's a patient. I took my brother out to the street. Then I came back and went up to the last floor that wasn't burning. I found a girl suffocating. She must have been about 19. She was suffocating. She was about to die. The head of the Civil Defence Unit says 90 people were rescued from the hospital. But the event has fueled anger about a healthcare system worn down by decades of neglect and left unable to cope with the pandemic. Officials say the hospital had no fire protection system and that false ceilings helped spread the blaze. And people are now demanding the health minister be sacked. On Wednesday, the number of coronavirus cases in Iraq surpassed 1 million, the highest of any Arab state. The blaze in Baghdad marks another grim development in Iraq's battle against COVID.
Germany is switching gears in the fight against the pandemic after months of struggling to contain a severe third wave of the virus. Tighter national restrictions were put in place this weekend, including a controversial overnight curfew. Our reporter Kate Brady was out in the capital, Berlin.
It's Saturday night in Berlin's Friedrichshain district, with just minutes to go before the new curfew kicks in at 10 p.m. Enough time to grab a quick beer or some late-night food for the road. Right on cue as the clock strikes 10, many local shops begin to roll down their shutters. Minutes later, police arrive to clear stragglers from the square. According to federal rules, repeated violators of the measures risk a hefty fine of up to €25,000. For most tonight, though, it's just a polite request to head home. The restrictions on movement during late hours have been met with mixed responses.
It's annoying, but maybe in the future these will allow to give us the freedom faster.
Wir akzeptieren das schon.
We accept it, but we can't completely understand it.
So ganz verstehen.
I don't think people infect each other so much outside. I think people will just go home together and keep on partying there. That's a problem for the spread of the infection, and it's counterproductive. By almost midnight, the streets have largely cleared. Travel by public transport or by car is only permitted for specific exceptions, including work and emergencies. Between 10 p.m. and midnight, walks and runs are also still allowed, including for Germany's four-legged residents. Now the question remains, exactly how long will this curfew even be allowed to stay in place, with several constitutional complaints around the country threatening to already bring the measure to an end. Should Germany's constitutional court indeed rule that the curfew is unlawful, it would be a huge blow, not least of all to German Chancellor Angela Merkel, who has been pushing for months for a stricter and more uniform response to the pandemic. For now, though, there will be many a quieter night in Berlin and beyond.